So next up, we're going to continue our discussion, and it will continue to touch on mental health issues, but we're also going to get some firsthand insights on this process, this very complicated process of reopening schools, which, the whole country and the whole world, in a sense, are at so many different stages of this process, and it's an incredibly unpredictable one, especially in the months ahead. As we just heard from Peter, the mental health ramifications of the pandemic for young people are a tremendous concern. The system as a whole has survived in large part thanks to virtual learning, but with that comes, obviously incredible challenges, as we said, both educationally and emotionally. As my participants introduce in a moment know all too well, there are no easy answers when it comes to reopening schools. Of course, you want to keep students, their families, and teachers safe from a deadly disease, but you also want to return some semblance of normalcy to students' lives, for educational and, again, for their mental well-being. So it is such a fine balance. We're all learning as we go. And so on that front, we're very fortunate to have two educators here today to offer their firsthand perspective on how their institutions have handled this dilemma of reopening. So we have Christin Soly, who is the executive director of the Merritt Academy, a private school here in Fairfax, Virginia, for students in K through 8th grade. She was once a student at Merritt Academy herself and later served as a teacher and camp director at the school. So very familiar with the school over the years. We also have Dr. Angela Joyner, who is the Chief Innovation Officer and Special Advisor to the President on Partnerships for Radford University, which is also in Virginia. Dr. Joyner also serves as a board member of the Women's Resource Center and founded the Wonder Loft, which is a positive leadership coaching practice for women. So welcome, ladies. Thank you for joining us today. Christin, I want to go ahead and start with you, in part because Merritt Academy really only closed for 2 weeks in March and has in general gone through this process of reopening, and I believe you are currently with the 2021 school year about 150 students in K through 8th grade, and then in addition with infants and 4-year-olds, a total of 350 students and about 120 staff members. This is quite impressive when you look at many area schools that remain open or are just slowly going into a hybrid model. So, can you just walk us through the reopening process at Merritt? What precautions you've put into place and what are some of the lessons that you've learned over these last several months?
Thank you, Anna. Yes, so it's hard to imagine that April 1st we reopened without masks, without a lot of anything, as we stepped in and really had to adjust with every new news broadcast and scientific study done and the bouncing ball of should we do this, should we do that? And at the end of the day, we've had an amazing team of teachers. It takes a huge community to come together and agree to do this. It's not just one person at a time. You have to have a team that's all really willing to come together and commit as a team to keeping our community safe. So we opened in April for essential employees only, with children of people that lived with COVID every day, ER nurses, people that were holding hands of COVID patients, and we had their children. And so the teachers on the front lines, really turned every day going, what should I do? We had teachers going home taking 2 showers a day, not sure if they washed their hands well enough, or somebody who held the door open really from when they walked in the door to when they got home, and could take everything off. And so that unknown and that stress level really added a real mental challenge. We worked with young children where You want to touch them. You want to give them hugs. That's necessary. It's a big thing that I know that's becoming more accepted, which is great, but there were times during this where we all kind of went, when are we going to be able to hug again? And I'm glad to see that that's becoming more accepted as we have, whether it's vaccines or a better understanding of how masks work and how time works and how this crazy disease works. So we really opened in 3 phases. We opened in April and started accepting more and more students. So we went from roughly 20 students that first day of April to about 50 come June. Mostly of our students that were coming back, we had to create real options for current families where there was no tuition because you can't really virtually teach an infant. But we were all kind of hoping that this would turn around quickly. That holding on to hope is definitely a mental game that has played tricks on a lot of people over the course of time, figuring out how you mentally take the leap of this is where we're going to be for a while, and what kind of investment you make into where we are now or where we're going to be, and that struggle. So we wanted to give parents the kind of time necessary to make that breathing room happen. So we gave lots of different options. We ended the school year for our elementary and middle school all virtual, from kindergarten to 8th grade. So we had a very small group of students that were here for essential employees in that elementary and middle school group, but most of them were virtual and 100% virtual. So we had a good platform, which was really important. Our middle school had already been doing a lot of virtual support for homework. So that kept us in a good place to just jump and keep going. We were able to use our middle school team to teach the rest of our teachers how to do this. And I'm very thankful for that. Throughout the summer, our preschool teachers did a hybrid where we had students in class and we had students virtually. And we saw the mental toll that took on our teachers. Doing both was very, very difficult. So we decided for our kind of phase 3. So in June, we had summer camp for kindergarten to 8th graders. Everybody had their, what we called islands at the time before pods became a phrase. So everybody had islands, and those of us in director positions were boats. We were the only ones that could stand at the dock, and everyone else had to stay on their island. And we really tried to keep everyone this is your space. You cannot leave this space. We started introducing masks first to the teachers, then to the older students. And we knew we were looking at a really rough road ahead as we looked at reopening in fall. We were seeing the struggles of what it was just for camp and our preschool and doing both. So we decided to jump in 100% on site and really put all of our mental and emotional and physical energy into that. The teachers coming back 5 days a week, doing it this way, it's hard. The students coming back 5 days a week is a lot of physical energy. We noticed our older students particularly really questioned, am I going to go home and give something to my parents? We saw middle school students that self-isolated even within the classroom because they were really worried and had to go through a lot those first few weeks of how do I balance being happy with my friends when I know that if I get close to them, I could make someone sick. And that mental toll back and forth was very challenging. Same thing with our staff, that mental challenge of should I get close? I really want to help them with math. And we got into what we called old habits. They're not bad habits. They're just old habits of getting really close to people. So there was a lot of reminders that were necessary. We installed desk shields. Even recently, we were masked not at our desks. Now we have to wear masks at our desks, and trying to find those breaks for our younger folks, trying not to get upset, to remind them to wear masks. Lots of reminders to wear masks. And I think overall, as I've talked to teachers, as I've talked to parents, as I've talked to students, everybody's so excited to be in person. We are seeing our neighborhoods where the academic needs are dramatic. The emotional needs are dramatic. Friends that aren't in school and are our students have those relationships virtually still with other students outside of school, and they're struggling. So it's been a definite process, but it comes with its own mental game coming back into the world. And we're continuing to try to find different ways of keeping things safe. We use our parking lot for outdoor classrooms. We have chopped up our regular playgrounds into 3 or 4 different spaces, so they each have individual play space outside where we don't mix islands. And it takes a lot of staff. So the investment that it takes to do this is quite significant. But the mental and the emotional is so worth it at the end of the day, even if we have to quarantine a classroom, which, is something that we've had to do. Although here at Merritt, we just had our first last week. We're very excited and went almost 9 months without a case here on campus.
That was my follow-up question, because, I know that that's what's on everybody's minds is, have there been infections and have you had to quarantine because of them? And, it's almost inevitable, but I'm sorry, go on.
No, we've been very happy. But I will say I tell the parents here, there's always a risk. You come on site acknowledging that there is a risk. We're doing everything possible to limit that risk. But obviously the safest option is to stay home. But there are a lot of families out there who are willing to take that risk for the emotional and the social things and the academic things that an in-person can still provide. While I am so thankful, and as I listened to the speakers before us, for the virtual silver linings that are there, and I'm so thankful for what we are still able to do and accomplish for so many. I have four of my own children. They're all here. I couldn't imagine having to have them virtually. Some would do very well. I know at least one of them really struggled for the last part of the last school year, and I'm very thankful that we are on site. It does come with a question of, do you go see grandma? Because we are the most exposed in my family. We are in 4 different classrooms. And I'm working every day on site. And so that's an awareness that we have as a family and as a community. I hear it from families. But our students are mostly at or above grade level. We've mixed with a lot of different students. We've added a lot of new students. We're using our library as a classroom. We took out all the computers from our computer lab, and that's a classroom. Our art room's a classroom. Our gymnasium is now split in half and is half staff lounge and half PE. It's definitely different. But I'll tell you, we love the outdoor classrooms. We're going to continue that all the way through. So there are some wonderful things about it. We do continue to get a lot of requests for kindergarten to 8th graders, parents who are saying this first quarter has now passed and we can't do this anymore. So we're continuing to try to get creative and finding ways to support them. But there are definitely people that are willing to take this step to be in person. We typically host a solidly big for us, international group of students every winter. It doesn't look like we'll have that this year, but it is a big part of our culture here in Fairfax is the diversity. And so we are hopeful to get that back up and running very quickly because there is an in-person that you can't, that exposure, particularly for young students, in person, that relationship with someone else who doesn't speak your language as well, and the odd things that we do differently that when you're in a classroom setting, you can't get anywhere else.
Right. Well, and I think you hit on 2 important points, which is this is such a individual dilemma for people because everyone's circumstances are so different, and it is a personal decision on weighing the benefits and the risks, and that is just really so varied for everyone and their personal situation. And then on the flip side also, we have how this pandemic has forced everybody, and including all kinds of institutions, to get very creative. I mean, every single day people are coming up with ingenious ways to connect and to get by. Not all perfect, as everyone can see with the cat show behind me here on a lighter note. We have a podcast and a webcast called Global 360, and it's become a running joke. I might do a hashtag that this cat cannot not be in the show. And if you have kids, Angela, you mentioned you have kids, you can't lock anything. They'll find a way, to come in. I think animals are the same way. I don't know. But anyway, back over, switching gears to the conversation. So Angela, what has been for you, the timeline and the process of virtual learning, reopening at Radford, and what kind of plans have you tentatively made moving ahead as we try to get through winter and into the spring semester?
Yeah, so we started our planning, once everything closed back in March, and pulled together a comprehensive plan with a contingency team full of faculty, students, staff, our medical professionals in the area, as well as talking with our peers. And we did everything from an education program that started virtually. We sent information to parents and students. We knew that recruiting students onto campus was going to have a totally different experience for our high school students coming in. We quickly shifted to virtual tours and virtual orientation. We reconfigured the classrooms to fit the appropriate capacities, and then determined for those that are larger classrooms would have to shift to online, and providing support for our faculty members to do so. Similar to what Christin was sharing, we brought folks back over the summer in phases. We brought back administrators, essential staff first, and then students and faculty came back in August. And we actually started the semester 2 weeks earlier than what we normally would, so that we could finish finals and graduation and everything by Thanksgiving to be able to be done prior to the winter time. We changed everything from limiting the amount of interaction that students could have, putting a lot of things online while still building opportunities for them to have connection. Most of our classes were face-to-face, with some of those being online. And then we also then had to introduce some hybrid, where the teacher had to teach face-to-face, but have some flexibility for those students who would have been quarantining or who unfortunately would have gotten sick during the semester, and then us helping to ensure that we're supporting those students. We stood up a call center for us to reach out to those students that were testing and who might have been in isolation or quarantining, to make sure that they had food, had all the medical supplies that they needed, and so that they knew that they had a personal connection, and then also notifying their faculty members so that they could stay up to speed with their classes as well. There were so many changes that I think, it is commendable what the faculty were able to do in such a short period of time, as well as I said earlier, partnering with our healthcare professionals. We had our own healthcare center on campus, but we also partnered locally for contact tracing, and we did prevalence testing before students came back on campus, and identified students who to get tested before they came back. And we also provided opportunities for faculty, staff, and students throughout the semester to get tested and get medical care if needed, and counseling, so that we can ensure that the environment and the ecosystem was safe for everyone coming back, and try to minimize any community spread, which we were fortunate to keep most of the cases contained on campus. And quite frankly, for a lot of our students, they wanted to be on campus. They had spent the semester at home, and they wanted and needed to be on campus. And for some of our students, the safest place is for them to be on campus, where they thrive in their own communities. And so as we move forward to the next semester, our students left a couple weeks ago. It's awfully quiet on campus without them, and they're due to come back to campus January 19th. And we will pick up where we left off. So we will do some prevalence testing for those students that are coming back. We also tested students, I didn't mention this, we tested students before they went home, because we knew that there could be some concern with students going home. And so we made testing available for both students and staff prior to the Thanksgiving holiday, before they went home, so that we could ensure that we're giving people every opportunity to test before they went home.
Mm-hmm. Now, I wanted to follow up on that. So just to make sure I have it clear. So when students are coming back, is the testing mandatory before they come back on campus? And then once they are back on campus, you have not instituted like a testing regime where every few weeks or so forth that students have to be tested. It is more keeping an eye out on symptoms and then dealing with a positive test once it happens in terms of quarantining. Is that correct?
Yes, and so we have identified students based on their self-report on a survey that goes out prior to the semester of students sharing and faculty sharing where they may have traveled. It's not just where, but it's also what are some of the activities that they might have been doing, which would then we would then request that they get tested prior to coming back on campus and getting their results prior to coming back on campus. Once on campus, if a student is showing symptoms or wants to get tested, they can go to the student health center and get tested. And then we also provided additional testing opportunities should they want to get tested, both faculty, staff, and students, to make sure that that was available. And so for some students that are identified through the prevalence testing, they needed to get tested before they could actually register and show up for class.
Okay.
And that worked out really well. I think we administered many more tests than what we anticipated or what we had originally thought, but it was the appropriate thing to do to ensure that we are ensuring safety for both our faculty, staff, and students.
Mm-hmm. Now, I have a question that this is very specific to university students. We all know that they can be quite social and congregate and party. And this is a huge problem that universities are dealing with, and they're all dealing with it kind of on their own ad hoc basis in terms of, discipline and enforcement and so forth. So what is Radford doing in that respect of, keeping students from, congregating in large groups, having parties, ensuring social distance and all of that?
So there was a couple of things, and you're right. It's social, socially gathering is definitely a part of the college experience. Prior to students coming on campus, they were asked to commit to doing a pledge. All of the Greek organizations also signed a pledge that they created on their own about how they were going to keep both their members safe and their activities safe. No organization or activity that was more than the meeting limit, so 10 or less, were approved from, on campus. I will say early on, our initial cases were driven by, 2 social gatherings that were outside of the requirements. Mm-hmm. Radford was pretty swift and suspended several students and several organizations on campus for not complying not only with the student safety conduct code, but also with the code in which their organization is set up. And so once those 2 things happened, I think students really started taking that pretty serious. And just like, we were talking about being creative, they're also creative as well about how to maintain social distance while being safe. And I'm pleased to say that a lot of our students did what they were supposed to do. Mm-hmm. Our student affairs group do all kinds of things of connecting with students. And quite frankly, I said it earlier, students want to be there. So students were also sharing and recording anonymously where students weren't following the conduct code. And they were dealt with quickly and swiftly, because we need to make sure that we're ensuring the safety of, one of our most vulnerable populations, which is our faculty. Right. And students really do want to be there. And I think once we got past kind of those first couple of weeks of move-in, we saw things taper off relatively quickly, and students really engaged in ensuring that they're keeping themselves safe, wearing masks to class, mm-hmm. And also ensuring that their gatherings are safe.
Great. Well, and so Christin, coming back over to you, what is, logistically, what does the Merritt Academy do in terms of its testing requirements? And also looking ahead, and I know this is, optimistically looking ahead, but, at some point, hopefully we will have a vaccine that will be widely available. I mean, of course, children probably be among the last to be vaccinated, but the issue of vaccination in children before the pandemic had become a contentious one. So could you talk a bit about, the testing regimen at Merritt Academy, and have you kind of formulated tentative plans of what to do once a vaccine becomes available on a more widespread basis?
Yeah, so the answer is pretty simple. Unlike Radford, we don't do any testing. We haven't done anything. Part of that is acknowledging where our students are as far as how often they actually get it. And from the beginning of this pandemic, children are known in general from a coronavirus-based perspective to not get it as often. We did consider it. We've been operating through the entirety. And it is something that as a private institution look at the cost for it, the interest in it actually was not very high in our world, both either from parents or teachers, maybe due to the fact of how it happens and the anecdotal stories that come out on how uncomfortable that is. I do think that communication through all of this is extremely important. So I spent hours upon hours making sure that every parent understood what our policies were in regards to not testing, or in regards to mask wearing, or in regards to anything else. Parents are not allowed through our doors. They're not allowed on campus right now. That's a lot of trust to give your infant at 3 months or your 8th grader at 12 to trust us to follow those rules behind our closed doors. Communication cannot be emphasized enough. Transparency is very important, so that everyone that comes in, it is a social contract, that they know that when they get to our door, it's not about whether your temperature is right, although we take it every day, or whether you've had any medication, although we ask every day. You should not come to our front door if those things don't match. And that is the social contract that our community as a whole plays. And it's really the only reason that I can say we've only had one case on campus that's quarantined any class. And frankly, in that case, everything started once the person was not here. All the rules were followed appropriately and well. And I'm just very thankful that everyone has followed that. And as we get into that vaccine world again, our age group is one of those varied, with a 13-year difference. I'm not sure if middle school students will be on that list or not, or high school students, or teachers. The teacher question will be one, and we have definitely teachers on both sides of that fence, those that are going to be signing up for the very first shot, those that are saying if this becomes a requirement, they're not sure what they're going to do. We see that on both sides, and I am a big believer in letting that be a choice. And if we are going to make a decision, to provide enough time for people to make, even if it's just a few weeks, to say, hey, here's where we're at. This is the way that we've chosen to go if we have a choice in the matter, if it's not a government decision. We did that when we decided to go back on site completely. We said, hey, please let us know by this date. We understand that on site may not be for you and your family. We don't want to hold you to something. We're not going to hard sell an on-site program. We don't want anyone here who doesn't understand what they're getting into and can really promise to keep our community safe. It does mean that when your child has the sniffles, you stay home a little bit more often, because you're self choosing that, not because there's a requirement, because there is a vested interest in keeping our school community healthy so that we can continue to support all the families and the teachers. And it sounds like that's what's happening at Radford as well. The students finally kind of caught on that if they want to stay, this is us together. It's not just one decision, that we all have to take that social agreement together. But I do believe it's a big communication piece. Getting on the phone was huge over these last several months. Even now, when we had a case, the very first thing I did at 7 o'clock at night is I pick up the phone and I call every single family that quarantine decision affects. We're inundated with emails. Email does not send the right message. So really getting on the phone and talking through everything that I can with as many people as I can. That transparency, that communication is huge. Regardless of what choice I think needs to be made in the future, being upfront so people know what they're getting in a time frame where you don't know a lot. The more you can give people to have some kind of control over their world is really important for parents, for students as well. Though our older students want to know what's coming next week, what's going to happen, what should happen if I get sick, and they want to know some of those, even if it's just skeletons that we can give them of an idea of what could happen. We've lost that ability to plan. The Myers-Briggs, the J people of the world that like those plans, I feel for them. I'm a P myself, but I feel for them. And, they have lost so much. And in the world of the mental game that takes, the emotional toll that takes on them, our students, our parents, our teachers, we need to do as much as we can to give them, even if it's just a few days notice.
Right.
The more we can communicate that out. So once there is a vaccine, hopefully we'll get a little time to make that determination and plan that out, so that everyone involved knows what their choices are, where they should be.
Yeah, no, it's definitely for people who rely on planning. This is a catastrophe, and I think on that note, what's impressive about both of your institutions is that you have been able to, return to in person while limiting, the negative repercussions, because there are so many institutions, schools, universities, colleges in this area who are going through kind of that whipsaw process of reopening and shutting down again. And in a sense that is almost worse than, picking one model and sticking to it for a while. And that is, I know, taking a mental toll. We've talked a lot about children, but on parents themselves. So I wanted to wrap it up because, Angela, you had mentioned briefly that you yourself are in quarantine because your child, son, daughter.
My daughter's classroom, her pod, is now quarantined. So,
I know that there are so many people who can relate to what you're going through. What have been some of just your personal, what have you personally learned through having to go through this process that a lot of parents are facing now?
Yeah. It's funny because, prior to COVID, you talk about work-life balance. And I think the difference is there wasn't before. I used to say you go through rhythms, but I think with COVID, everything has been integrated and combined, right? For a lot of parents and people that are working, their homes have now become their workplaces, and also childcare and school and preschool. And, fortunately, very similar to other places, her daycare was open the entire time. So, I didn't have to acclimate. I went to work because I was essential, and then I come home and I do that. But, in the last couple of weeks, you just figure out what the right balance is, and you make different choices. So, we probably have had more pizza in the last few days and Skittles to kind of get through some key meetings than and an iPad, which I normally wouldn't want, we normally don't have on. But I also know that this is a blink in, my daughter's life, right? This won't go on forever. But I've also look on the other side and say, like, I'm really getting to spend some time and seeing some milestones that I don't think I would see, that her teachers would have had the opportunity to see some of her growth milestones that I'll miss, right? So during this pandemic, I've been able to wean her off of a pacifier, potty train her in a week, and, learn, seeing how she's evolved, which has been awesome on those times that I've actually been home, with her. But it is a challenge. And I think, what I've learned is to have a little bit more grace. Everybody's going through the same thing at the same time. And so, you mentioned your cat. I've seen all kinds of animals fly, come through. A parakeet got out in one of our meetings, and, it's fodder for the conversation, but I think it allows us to also be human, because that's what we all are, trying to navigate a really serious pandemic, but at the same time, it's also an opportunity for us to connect with our families. And so it is a struggle, and sometimes it can be a little bit stressful. But like I said, this is not going to last forever. It'll look different, but I also appreciate the time and some of the things that have been positive about being able to connect with family and friends during this season.
Yeah. Well, no, I mean, and that is a perfect, really way to end it, because that is something, even on, the most difficult topics that we've broached today, is there has always been a positive element. And as you said, we are all in the same boat. And I think, Christin, as you mentioned, the importance of communication, and Angela, grace, and a whole lot of patience, because we are all learning as we go. And that goes for all levels, from children to the eldest adults. So I want to thank both of you for all of these insights, and there's a lot more to come for the audience. I want to remind them that they can continue to network. We can continue to connect virtually. We've all gotten very creative, and this platform, I really like Hopin platform. So it's really easy. You kind of just go off to the left-hand side. You click networking, and it's like speed dating. You can chit chat with somebody for 3 minutes, the same way you kind of would, in an in-person conference. And you can also learn more about some of our sponsors, such as the Merritt Academy. If you click below that to Expo, there are booths there where you can speak directly to folks. And we have another full day lineup of discussions because I mean, my gosh, there are just so many different elements of this pandemic. It's just so hard to know where to even begin. But tomorrow we are excited to have Arne Duncan, who was the longtime former education secretary under President Obama. So he's going to talk about his insights into. I think that's your. Is that your daughter back there? No.
No.
So Arne Duncan is going to talk, and obviously has a lot of personal views of President-elect Joe Biden, and so we're excited to have his thoughts on what we can look forward to in a brand new administration that's going to obviously have huge changes for education. We're also going to talk with ASU University in Santana, which is building a lot of interesting partnerships and taking this online learning to kind of the next level of partnering with institutions overseas. We are also going to have talk about women at the forefront of STEM and kind of how the pandemic again has affected that, as well as we'll hear directly from some embassy education attaches, including from China and Saudi Arabia, who have been, again, affected not only by the pandemic, but the political winds here in the U.S. So a lot to unpack, but hopefully this offers a lot of interesting insights to everybody. So we hope you can join us again, 9 a.m. To 1 p.m. tomorrow. And if you have any questions in terms of, hopping on, you can always email us, news@washdiplomat.com. And once again, please continue to feel free to network, and wanted to thank Angela, thank Christin, and thank all of our panelists today for their wonderful insights. And thank you everyone for joining us as well. Take care.
Studying or teaching abroad can be an exciting opportunity. It can also come with a lot of uncertainties when it comes to accessing care. Cigna StudyWell from Cigna Global Health Benefits was designed specifically with your globally mobile students and faculty in mind. They'll have access to the largest global network of healthcare providers, plus a wide array of 24/7 support resources. So they'll have peace of mind, knowing that when they're away from home, they're not far from care. To learn more about Cigna StudyWell plan options, contact your Cigna representative.